Yes, Dr. Ali. Now you can lead, please.
The first question we have, we get it from Twitter, is about, can we detect the virus within 24 hours after a potential exposure through PCR technique? If not, please tell me when, and I can detect the RNA. Actually, it depends on the viral load and when the patient is infected and other comorbidities, and also the incubation period, which is from 2 to 14 days. This is very important. You can detect it within the second day or sometimes within few days, but it depends on each patient alone. Okay. The second question we have is about, can you change the slide again, please, for the question? The second question, please. The second question will be, how worried should the public be about? Okay, thank you. How worried should the public be about possible global shortage of ventilators that are essential for elder populations diagnosed with COVID-19? The question is open for the speaker, so please. Dr. Lee?
Sorry, that's for me? This question is for me? Okay. Yeah, I think, the first thing, like what I'm talking, so if we did something very early, so that we can prevent the development of lung injury instead of use the ventilator. So like, what I'm talking, these are all very old, the old man and the old woman. So if we, reduce the fever within 2 days, and then the cytokine storm will stop, and nobody will, they don't need to be ventilated. So, this is the important part. So I think, it just depends on how early, prevention measures you did, So if you cannot do things very good in the early stage, and then certainly you need a lot of intubations, but I don't want that happens. We don't. If you have enough ventilator, we don't have the medical staff. So how you can deal with that?
Okay, thank you so much. The third question, I think it's for you, Dr. Lee, again.
Yes.
Where did CT scan fall in the disease process from the experience of China and Italy? Did you use CT findings alone to diagnose triage patients, start treating them, and or decide on whom to intubate, or is it based on clinical parameters?
I don't have experience in Italy, but in China, we did use CT scan quite a lot, but we never use CT alone because the CT the diagnosis, we did some study. We did see the CT cannot be very, in the diagnosis part is not so sensitive and specific. So we cannot do that because maybe sometime you did find some patients, they only have some kind of mycoplasma. So, but certainly we just monitor the SpO2 and with some other symptoms and to triage patients, and not only based on the, the CT
scan. Thank you so much. I think we will have the other speaker now. From China. I think Dr. Bing has emergency, and she will replace him. Dr. Sao, is that right? Dr. Sao, you are online? Dr.
Yes.
Bing?
We have one more question, boss. For Dr.
Okay.
Why COVID-19 started in massive outbreak in Italy and Spain, not like other European countries? Could we know the number of health workers have been infected in Italy and how they got infected?
Do you want me
Dr.
to?
Baldino is around?
Yeah, I am actually.
Yes, please.
So I can start from the second question. So in Italy, it's more than 600 health workers who have been affected. And why did it start? How? So certainly, it's very hard to compare Italy and Spain. First of all, because the pace of the spread in Spain is completely different than Italy, and it's almost a month of delay. So it's mostly perhaps the question to ask is whether we started to why it started in Italy a month earlier than in the other European countries. I would say it's a combination of factors. So first of all, we tested. So the first patient actually was tested beyond the WHO guidelines. So it was just somebody that they had no contact with anybody who was traveling from China, not the typical pattern. So but then because they couldn't understand what was happening, they tested for COVID as well, and so they did diagnose him, and then after that, they understood that actually it was a cluster, that was an outbreak. So, that's why it's perhaps started this way, just because we started to find something where we were not supposed to look for. And then why and how, it's a matter also of luck and settings. So perhaps during trading activities, there was a contact we don't know. I think that even a month of difference is not that much in the long term. And what we will have to do is just to monitor closely and also to understand the shape of the epidemic curve and how they differ from one country to the other, as I was showing in my slides. And that is something that will be essential in the future to understand, and also comparing with the non-pharmaceutical intervention which have been put in place.
Thank you. Yeah. The next speaker will be from China, and she will be talking about Chinese